Could low testosterone be the hidden cause of depression in some men? And if so, could testosterone replacement therapy, TRT, be a solution? Recent studies suggest that testosterone may play a key role in mood regulation. But is it a proven treatment or just a hyped-up theory? Let's look at the science. What is testosterone replacement therapy, TRT? TRT is a medical treatment used to restore testosterone levels in men with clinically low testosterone. Symptoms of low testosterone include fatigue, low libido, brain fog, and mood disturbances. Emerging research suggests a possible link between testosterone deficiency and depression. But what do the studies say? Scientific research has investigated whether TRT can help treat depression. Here's what we know so far. A meta-analysis of 27 randomized placebo-controlled trials found that TRT significantly improved depressive symptoms in men with low testosterone. Higher testosterone doses, above 500 milligrams per week, showed a stronger antidepressant effect. Some research suggests testosterone influences serotonin levels in the brain, similar to how antidepressants work. How does testosterone affect depression? Testosterone may regulate dopamine and serotonin, key neurotransmitters linked to mood. It may enhance neuroplasticity, helping the brain adapt to stress. Some men with treatment-resistant depression report improvement after TRT. But TRT is not for everyone. While TRT may help some men, it also comes with risks and is not suitable for everyone. Possible side effects include increased aggression, mood instability, and even manic symptoms. TRT can also impact cardiovascular health and may increase blood clot risk. A full medical evaluation is necessary before considering TRT for depression. Is TRT an approved treatment for depression? Current psychiatric guidelines do not list TRT as a standard treatment for depression. TRT is only recommended for men with clinically low testosterone. Doctors warn against using TRT as a quick fix for mood issues. Testosterone and mental health are closely linked, but TRT is not a one-size-fits-all solution. A medical consultation is absolutely necessary before considering it. Want more? Subscribe for the latest research. Don't forget, check the video description for links to the scientific studies.